Question 1. Which hormone is secreted in response to low blood glucose levels? A. Insulin. B. Glucagon. C. Cortisol. D. ADH. Answer: B. Glucagon. Question 2. What nursing action is the priority when caring for a patient with newly diagnosed myxedema? A. Encourage high-protein diet. B. Maintain a warm environment. C. Monitor for bradycardia and respiratory depression. D. Restrict fluid intake. Answer: C. Monitor for bradycardia and respiratory depression. Question 3. Which hormone is produced by the anterior pituitary to stimulate adrenal cortex function? A. TSH. B. FSH. C. ACTH. D. GH. Answer: C. ACTH. Question 4. The nurse is preparing to educate a patient on corticosteroid therapy. Which teaching point is most important? A. Increase intake of potassium-rich foods. B. Discontinue the drug if experiencing weight gain. C. Take medication at bedtime. D. Avoid dairy products. Answer: A. Increase intake of potassium-rich foods. Question 5. Which of the following is a symptom of hypoparathyroidism? A. Tetany. B. Polyphagia. C. Flush skin. D. Tachycardia. Answer: A. Tetany. Question 6. Which patient requires the most immediate nursing assessment? A. A patient with hyperthyroidism reporting palpitations. B. A patient with hypothyroidism reporting constipation. C. A diabetic patient with dry mouth. D. A patient with Cushing's reporting facial swelling. Answer: A. A patient with hyperthyroidism reporting palpitations. Question 7. What is the primary function of the pineal gland? A. Regulate metabolism. B. Produce cortisol. C. Control circadian rhythm. D. Regulate calcium levels. Answer: C. Control circadian rhythm. Question 8. What would be a priority nursing action for a patient with a calcium level of 6.5 milligrams per deciliter? A. Provide low-calcium diet. B. Monitor for signs of tetany. C. Encourage ambulation. D. Increase fluid intake. Answer: B. Monitor for signs of tetany. Question 9. The nurse receives 4 patients with endocrine disorders. Who should be seen first? A. A patient with Addison's disease and dizziness. B. A patient with diabetes insipidus and thirst. C. A patient with hypothyroidism and dry skin. D. A patient with type 2 diabetes requesting insulin education. Answer: A. A patient with Addison's disease and dizziness. Question 10. A nurse is caring for a patient receiving levothyroxine. Which findings should be reported immediately? A. Weight loss. B. Palpitations. C. Increased energy. D. Decreased appetite. Answer: B. Palpitations. Question 11. Which gland is responsible for regulating the body's response to stress? A. Pituitary gland. B. Pancreas. C. Adrenal gland. D. Thyroid gland. Answer: C. Adrenal gland. Question 12. The nurse suspects a thyroid crisis in a post-op thyroidectomy patient. What is the priority intervention? A. Offer warm fluids. B. Administer acetaminophen. C. Apply a tracheostomy tray and notify provider. D. Monitor TSH level. Answer: C. Apply a tracheostomy tray and notify provider. Question 13. What action by a UAP caring for a diabetic patient requires intervention by the nurse? A. Assisting the patient with hygiene. B. Documenting fluid intake. C. Performing capillary blood glucose testing. D. Administering insulin. Answer: D. Administering insulin. Question 14. What electrolyte imbalance is most associated with adrenal insufficiency? A. Hypernatremia. B. Hyperkalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hyperkalemia. Question 15. A nurse is teaching about the role of T3 and T4 hormones. What is their main function? A. Stimulate cortisol production. B. Regulate metabolic rate. C. Control blood calcium. D. Promote erythropoiesis. Answer: B. Regulate metabolic rate. Question 16. Which endocrine gland secretes both endocrine and exocrine substances? A. Thyroid. B. Pituitary. C. Adrenal. D. Pancreas. Answer: D. Pancreas. Question 17. The nurse is caring for a patient with Cushing syndrome. What intervention should be prioritized? A. Monitor blood glucose levels. B. Encourage a high-calorie diet. C. Restrict salt intake. D. Promote rest. Answer: A. Monitor blood glucose levels. Question 18. Which hormone, when deficient, results in diabetes insipidus? A. Insulin. B. Aldosterone. C. ADH. D. Cortisol. Answer: C. ADH. Question 19. What is the expected action of calcitriol on serum calcium levels? A. Increases renal calcium excretion. B. Promotes calcium absorption in the intestine. C. Suppresses parathyroid hormone. D. Inhibits bone resorption. Answer: B. Promotes calcium absorption in the intestine. Question 20. Which nursing action is appropriate for a patient receiving radioactive iodine therapy for hyperthyroidism? A. Encourage fluid restriction. B. Provide a high iodine diet. C. Instruct on radiation precautions. D. Administer with milk. Answer: C. Instruct on radiation precautions. Question 21. Which assessment finding is most concerning in a patient with suspected adrenal crisis? A. Mild fatigue. B. Blood pressure 82/46 mmHg. C. Decreased appetite. D. Generalized weakness. Answer: B. Blood pressure 82/46 mmHg. Question 22. What is the function of somatostatin produced by the pancreas? A. Stimulates glucagon release. B. Inhibits insulin and glucagon secretion. C. Promotes glycogen breakdown. D. Enhances digestive enzyme activity. Answer: B. Inhibits insulin and glucagon secretion. Question 23. A patient taking long-term corticosteroids is at risk for which complication? A. Addisonine crisis. B. Hypoglycemia. C. Osteoporosis. D. Hyperkalemia. Answer: C. Osteoporosis. Question 24. Which action is most appropriate to delegate to a licensed practical nurse, LPN? A. Teaching a diabetic patient how to self-administer insulin. B. Assessing a newly admitted patient with DKA. C. Administering subcutaneous insulin. D. Interpreting blood glucose results. Answer: C. Administering subcutaneous insulin. Question 25. A nurse is caring for a patient with hyperparathyroidism. Which lab value requires immediate intervention? A. Calcium 12.1 milligrams per deciliter. B. Phosphate 3.2 milligrams per deciliter. C. Sodium 137 milliequivalent/L. D. Potassium 4.1 milliequivalent/L. Answer: A. Calcium 12.1 milligrams per deciliter. Question 26. Which hormone released from the adrenal cortex aids in fluid balance? A. Epinephrine. B. Aldosterone. C. Cortisol. D. ACTH. Answer: B. Aldosterone. Question 27. What is a priority nursing diagnosis for a patient with SIADH? A. Risk for infection. B. Fluid volume deficit. C. Risk for electrolyte imbalance. D. Decreased cardiac output. Answer. C. Risk for electrolyte imbalance. Question 28. Which finding in a diabetic patient would require urgent follow-up? A. Hemoglobin A1C of 6.8%. B. Morning glucose of 102 milligrams per deciliter. C. Foot ulcer with purulent drainage. D. Capillary refill time of 2 seconds. Answer. C. Foot ulcer with purulent drainage. Question 29. Which hormone stimulates uterine contractions and milk ejection? A. Oxytocin. B. Prolactin. C. LA. D. Estrogen. Answer. A. Oxytocin. Question 30. Which nursing action is appropriate when preparing a patient for a dexamethasone suppression test? A. Instruct the patient to fast for 8 hours. B. Administer a radioactive tracer. C. Withhold insulin on the test day. D. Monitor blood pressure before and after test. Answer. A. Instruct the patient to fast for 8 hours. Question 31. What is a priority nursing intervention for a patient with a serum potassium of 2.9 milliequivalent/L and Cushing syndrome? A. Encourage fluid intake. B. Initiate seizure precautions. C. Monitor for muscle weakness and cardiac changes. D. Place the patient in Trendelenburg position. Answer. C. Monitor for muscle weakness and cardiac changes. Question 32. Which hormone acts as the major antagonist of insulin? A. Glucagon. B. Somatostatin. C. ADH. D. Calcitonin. Answer. A. Glucagon. Question 33. The nurse reviews lab results for a patient with hypothyroidism. Which results should be reported? A. TSH 6.8 IU/ml. B. Sodium 140 milliequivalent/L. C. Glucose 98 milligrams per deciliter. D. Potassium 4.0 milliequivalent/L. Answer. A. TSH 6.8 IU/ml. Question 34. What is the main function of the anterior pituitary gland? A. Produce ADH and oxytocin. B. Release hormones that stimulate other endocrine glands. C. Regulate circadian rhythms. D. Secrete digestive enzymes. Answer. B. Release hormones that stimulate other endocrine glands. Question 35. The nurse is caring for a patient with hyperthyroidism. What dietary modification is most appropriate? A. High-calorie, high-protein diet. B. Low-protein, high-fat diet. C. Low-sodium, low-fat diet. D. High-fiber, low-calcium diet. Answer. A. High-calorie, high-protein diet. Question 36. Which clinical manifestation is most consistent with a pheochromocytoma? A. Persistent hypotension. B. Bradycardia and sweating. C. Episodic hypertension and headache. D. Polyuria and weight loss. Answer. C. Episodic hypertension and headache. Question 37. Which condition is most likely when the posterior pituitary fails to produce adequate ADH? A. Diabetes insipidus. B. SIAD. C. Addison's disease. D. Hypoparathyroidism. Answer. A. Diabetes insipidus. Question 38. A nurse is assessing a patient for signs of hypoglycemia. Which symptom is expected? A. Warm, flushed skin. B. Slow heart rate. C. Irritability and tremors. D. Dry mucous membranes. Answer. C. Irritability and tremors. Question 39. The nurse notes that a patient with acromegaly has large facial features. Which hormone is likely elevated? A. Prolactin. B. ACTH. C. Growth hormone. D. TSH. Answer: C. Growth hormone. Question 40. What instruction is most appropriate for a patient beginning levothyroxine therapy? A. Take with meals for better absorption. B. Take at bedtime with a full glass of milk. C. Take on an empty stomach in the morning. D. Skip the dose if experiencing palpitations. Answer: C. Take on an empty stomach in the morning. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.